Good day everyone, I'm David, the moderator for this webinar. I welcome everyone for today's webinar, which is CPT Changes 2024. I would now like to introduce our presenter for today, Lynn Enderenin. Lynn Enderenin, CPC, CPB, CPPM, CPMA, CPC1, COSC has over 40 years of experience in all areas of the physician practice, specializing in orthopedics for AAPC. Lynn is currently a VILT instructor, workshop, and audio presenter. She is the founder of her local chapter and a former member of the NAB. I would now like to hand over the floor to the speaker. Over to you, Lynn.
Thank you, David. Hi, everybody. Welcome to today's webinar. Today we want to talk about the changes that have been made to the CPT manual for 2024. The first thing we're going to talk about is the evaluation and management services. We went through some documentation guideline changes first in 2021 with the changes for office and outpatient services. And then in 2023, we went through the changes for all of the other types of visits, for example, nursing home, hospital. What we have now in 2024 are some revisions to those guidelines. Things that have maybe been a problem or an issue they're trying to correct. So let's go ahead and start taking a look at those first. So the first thing I want to look at here is the inpatient and observation codes. We can only bill one evaluation and management service on a calendar day. Now they have changed that to state that if there were visits taken, performed in two different facilities or different places of service, we can now bill each one of those separately. Also, consultations are still in the CPT manual, and they are used for inpatient visits, outpatient visits, and observation visits. What has changed about consults is that we can only bill one consultation per place of service for a patient. The emergency department is not a place where you're going to be able to use time. You're going to have to use the medical decision-making tool. 99281 is equivalent to 99211. Nursing facilities. These are used for both nursing and skilled nursing facilities. We have the home or residence services, which includes the domiciliary, rest home, custodial care, home care. They did change 99212 from 20 minutes to 10 minutes. Now Medicare has their own prolonged service codes. So I did list the primary codes here. Codes are used per the primary code. So for shared split visits, this is something that's become a little bit complicated. They have two different kinds of split shared visits now. Shared split visits for the hospital. There are circumstances now where we can bill multiple evaluation and management services on the same day as some other kind of service. They also wanted to clarify the description of risk. The risk for the provider in anything they do for the patient has to be considered here. Telehealth. This has been a big question. Revised rules that we had during the pandemic are no longer valid. For 2024, they've added health and well-being coaching. The COVID-19 PHE Medicare Telehealth Services has a list of codes that you can take a look at, and it tells you when they are going to be deleted, if they are. The most of them are going to be applicable until the end of the year. Now we're going to look at the CPT code changes other than evaluation and management. The next thing that has changed are the bunion codes. Here are the rest of them, all again revised to now. In the respiratory system, we have two new codes for endoscopic ablation in the nasal sinus area. They've also added a lot of codes, and they've done a lot of revising of neurostimulator codes in general. In the urinary system, there has been one code change or one code add for cystourethropy. It's 52284. We also have, again, another new radio frequency code for ablation of uterine fibroids. Another addition to stimulator codes is for a skull-mounted cranial stimulator. There are also some changes to the spine neurostimulator codes, both for 63685 and 63688. Other stimulator code revisions, they added to 64590 and 64595. Peripheral nerve stimulators, they've gone ahead and added these also. And there is an add-on code here. As normal, there is a new code in the ophthalmology section, and so this is for the injection of a pharmacologic agent into the supraoid space. In the diagnostic radiology, there is a code addition for the heart. And this is a coronary fractional flow reserve, or an FFR. Intraoperative ultrasound. All right, in the laboratory section, there's always a lot of changes. These are all related here to solid organ neoplasms. Here are codes that have been added to the chemistry, immunology, and microbiology sections. The proprietary lab analysis. We added a couple of injections to RSV, and then we also have a lot of new codes for COVID-19 injections, as well as these. And here's even some more. And here's some more. And that was one last page of them. Other vaccines, these are 3 other vaccines. There's a couple more RSV vaccines listed here. And then there's some new ones here for the smallpox. In the medicine section, we have codes for a diagnostic otolaryngology analysis. So here is the programming for those Phrenic nerve stimulators. And then we also have some add-on codes for venography of the congenital heart defects. And here's some more. A chemotherapy procedure now being performed, which is a hyperthermic intraperitoneal chemotherapy procedure, or HIPEC. And we also have caregiver training services. Then there's also a code for group caregiver training. All right, that's all I have as far as the slide presentation. So that was the highlights of the changes in this CPT book for this year 2024. Identify changes that you deal with on your codes for any specific day. So good luck in 2024, and we'll see what else comes our way in 2025. I'm expecting the telehealth to be a big portion of 2025.
Thank you, Lynn. That does conclude the session for today. Thank you everyone for participating. You may all disconnect now. Have a wonderful day ahead.